The whole issue of cardiovascular disease in patients with diabetes is one that we have known for decades is so important. It has always been the primary cause of death in a patient with type 2 diabetes, and also the primary source of morbidity. So somebody who has type 2 diabetes is at high risk for heart attack, stroke, and other related macrovascular diseases. So the question is, how do we address that? Well, for many years, we've had the theory that just simply lowering glucose is adequate because there is a relationship between glucose levels and macrovascular disease or cardiovascular disease that we've known. We've also had a couple of medications, several medications actually over the years, that have shown some evidence for the ability to reduce cardiovascular events. What we have had most recently, and this goes back a year or two now, is a very large, very convincing cardiovascular outcomes trial in the contemporary environment where we're using a lot of statins, we're using a lot of ACE inhibitors. We haven't really had these necessarily in the earlier trials. But EMPA-REG is a trial in particular that really was groundbreaking in the sense that here we have a new class of agents. We've got the SGLT2 inhibitors. We have empagliflozin, a member of that class. We have a large cardiovascular outcomes trial that looks at these endpoints in the setting of use of this drug in a randomized double-blinded trial. And what that trial has shown is convincing evidence for reduction in cardiovascular disease events in general, and in particular, cardiovascular death, which is, of course, our most important cardiovascular endpoint. So EMPA-REG is a huge step forward in terms of our ability to take a patient with type 2 diabetes, put them on an agent, and reduce this very large problem of cardiovascular disease risk. Now, what we're seeing with EMPA-REG is not only the initial results, but we're now getting deeper into the data. We're looking more carefully at what did go down, what didn't go down, what were the benefits, were there any risks associated? And the quick answer is many more benefits than risks, but we're looking more carefully there. And one thing also that we're beginning to get at, and this is in some ways one of our most important questions, and that is the mechanism. How is it that empagliflozin does what it does? We know for a fact that every drug that lowers glucose does not lower cardiovascular disease. We've proven that many times over. So EMPA-REG as a trial and empagliflozin as an agent kind of break through the barrier of no relationship, which we've seen in many trials recently, to show benefit. And then the question is, why is that true? What is the mechanism? Can we understand this to better focus our treatment on the right patients, to better achieve this reduction in cardiovascular risk that we so much want to achieve in our patients with type 2 diabetes? So EMPA-REG was a breakthrough study, and now we're getting further into the details and learning things that I think are both of clinical and hopefully also of mechanistic importance.